Today I'm going to give you some tips on how to solve acid reflux. Now, acid reflux has a lot of symptoms, from heartburn and chest pain to coughs, sore throat, sour taste in your mouth. There's a lot of things that come from acid reflux. Now, here's the thing. If you're out there and you take acid reflux medication, you're not alone. Up to 15 million people a year take acid reflux medication. So, I'm going to give you tips, obviously, that are natural. I do not like acid reflux medication, which I'll get into in a second. But before you stop any medication, always speak with your physician and make sure that my suggestions are right for you, and don't come off a medication until you talk to your doctor. That being put to the side, let's talk about the natural ways that you can take care of acid reflux. Now, real briefly, acid reflux, in my opinion, and from most studies, show that it is not from too much acid. You think, wait a minute, it's acid reflux, it has to be from too much acid. No, it's actually from too little acid. Real briefly, you eat food, it goes down the esophagus, through this little valve called the lower esophageal sphincter, the LES. Past that valve, then it goes into the stomach. That is where the acid is produced. That is where acid should be produced. It kills bacteria. It helps you absorb critical nutrients like B12, iron, magnesium, calcium, vitamin C, protein. You could go down the list. So many nutrients, so much food is needed to be digested properly with acid. So if you don't have enough acid, guess what? You're not breaking down those nutrients. That's why people on long-term use of antacids, long-term use of proton pump inhibitors, that type of medication, have been shown to have an increase in dementia, an increase in osteoporosis, an increase in kidney disease. Now again, before you come off medication, go talk to your doctor. But those are the facts according to scientific research. So, what are you going to do? If the problem is not having too much acid, and the problem is having too little acid, the problem is the valve is not staying shut, what are you going to do? Here are the tips. First, you want to make some lifestyle changes. Number one lifestyle change, quit smoking. Smoking scientifically has been proven to cause acid reflux, been proven to weaken that valve. So stop smoking, and that will be the first lifestyle change you can do to decrease acid reflux. Number two, don't eat a huge meal. Having smaller meals helps with acid reflux. If you eat too big of a meal, just the size of the meal will push up on that valve and possibly cause acid to leak up into the esophagus. That's the tissue, that esophageal tissue, that is not meant for acid. While the stomach is meant for acid, the esophagus isn't. The acid hits the esophagus, even if it's a little bit of acid, will create that type of heartburn, burning sensation, and that is what you want to stay away from. So, smaller meals. The third one, don't eat too close to bedtime. If you eat too close to bedtime and then you lay down and you're horizontal, the acid will leak up and boom, acid reflux symptomatology. The fourth one, again with laying down, you can elevate your bed with a little bit of a wood plank. That creates a little bit, you're using gravity to help the acid come down versus staying low and up. And that will also help with acid reflux. So those are some lifestyle changes. Food changes. While you are correcting this problem, we want you to start producing a little bit more acid. The acid actually helps keep that valve shut. Too little acid allows the valve to stay open. So I recommend a little apple cider vinegar, not a ton, a teaspoon with a glass of water, but not just in the morning time. So if you're going for weight loss, if you're going for sugar control, a lot of people talk about apple cider vinegar just in the AM. I'm recommending apple cider vinegar before every single meal you have. So that way, the acid is produced for each meal and you can digest each meal properly. It doesn't always work perfectly, but apple cider vinegar is one thing I recommend. The second thing I recommend food-wise is to start bringing in more antioxidants, specifically polyphenols. Those are plant super nutrients that really help reduce the inflammation of the stomach and the esophagus. They help with acid reflux. Specific ones are pomegranates, blueberries, and there's a whole lot more. But those types of foods, those types of nutrients are very effective. Foods you want to stay away from, it's a very common list: coffee, chocolate, garlic, onions, tomatoes, spicy foods, citrus foods. You're going to see that over any type of literature. Those are the foods that can create some inflammation. And while you're taking time to start stimulating that acid, keeping that valve shut, stay away from those foods. As you start feeling better, slowly start reintroducing the foods you want and see how your body handles it. Now, supplement-wise, I recommend a probiotic, mine specifically, Dr. Stern Rebalance, for a couple reasons. Number one, the good bacteria have been proven to not only fight off the bad bacteria, not only does good bacteria help